So I'll just quickly come to issues around neurodivergence in specific groups such as ethnic minority populations and also women and girls. So to what extent do you consider that current policy and pathways in place in Scotland meet the needs of ethnic minority people and women and girls, for instance, or, as we're hearing, don't meet the needs?
Take it time. Yeah. So I'll respond, but I think we can obviously can all contribute. But given that SWAN is a charity that's focused on working with women, girls, and non-binary people, I'll start. I think in general the pathways fail to take gender into consideration at all, really, largely because they're using diagnostic practices and diagnostic tools that were developed a very long time ago, before there was really any kind of awareness or understanding that it was even possible for women and girls to be autistic. And autism can present very differently across genders for a number of reasons. So the tools that are used for assessment and diagnosis are not really fit for purpose a lot of the time for women and girls and people of other genders. They don't really tease out the way that autism might present in us in the same way. They don't necessarily pick things up. I think there's also a much lower awareness generally in how autism presents, in what the reality is for being an autistic woman or an autistic girl. So that awareness isn't really there amongst practitioners, amongst GPs, amongst educators, employers, families, etc., and ourselves as well. You know, a huge proportion of us have no idea that we're autistic until we're in our 40s, 50s, even later. So if we've not got that awareness, you know, we can't. It's no surprise that it's not there. Women are much more likely to mask, much more likely to act in a particular way to try to fit into society, and that's very much. It's very common for women in our society. We do live in a gendered society anyway, and much more so if you're autistic, so it's less likely to be picked up. And there isn't that understanding and those tools and that openness to listening to and believing, I think, autistic women to pick up what's really going on. And to go back to diagnosis, we are often told, it's just you're anxious, it's just your hormones, why don't you try this, why don't you try that? So I think, you know, it's not really sort of fit for purpose. We're frequently dismissed or invalidated when we do finally go and seek help. And, you know, the cost of that, obviously it's costly to resource a massive change in the way that we're diagnosing things, in the way that the pathways are put together, but there really does need to be a shift. The diagnostic process is not fit for purpose. It's quite humiliating. It focuses on deficits, on making yourself incredibly vulnerable and talking about all the ways that you fail in society. But the impact of not having that pathway in place in terms of mental health, in terms of suicide figures, in terms of medication and patient care, and things that Sophia was describing before, is obviously much more costly in a range of ways. But there certainly needs to be, I think, some quite significant change in order that moving forward we're not waiting until we're 50 and 60 to be diagnosed. Men or boys tend to be diagnosed, not all, but more often younger. So there's not this kind of huge influx and huge burden of people looking for diagnosis, and there's not that impact of living most of the way through your life not knowing who you are, what your needs are, and how to have those met as well.